Hello and welcome to Community Connection. I'm Iowa City Mayor Bruce Teague. The Black Lives Matter movement is challenging us to examine ourselves and our systems to identify and remove barriers that prevent all of our community members from enjoying the same opportunities. We could all do our part, whether it's taking part in a demonstration, donating money to social justice groups, or making changes at your workplace. The first step to any change is having those tough conversations about the issues. Joining me to do that today is Dr. Nicole Del Castillo, the Director of the Office of Diversity, Equity, and Inclusion at the University of Iowa Healthcare, Carver College of Medicine. Thanks for joining me.
Hello, happy to be here.
I'm so excited that you're here. So of course I heard you a couple of Sundays ago at church, and I thought I gotta bring you on just to talk to you.
Of course, I'm happy to share and have this conversation with you today. So, yes,
So I know that you grew up in Champaign, Illinois,
I
and
did.
and so tell me what has been your experience as a Black woman in America.
So I grew up in Champaign, Illinois, and another college town similar to Iowa City. And in the 80s and 90s, when I grew up, Champaign was fairly diverse, I think, for the size of town, even though it's not very large city. I feel like because of the university, it brought a lot of diversity, racially, ethnically, and socially, and economically, for sure. But feel like from an early age, I did experience, examples of overt and covert racism. I was often the only Black student in my classes and often, having those feelings of, do I belong? Those, thoughts of imposter syndrome. Do I belong here? Am I just kind of that token person or the token Black person that they have here? And having examples where I remember when I was in second or third grade, and I was at my friend's house for a class project, and her neighbor, who was outside when we were all outside kind of working on this class project, her neighbor came over and, said, "Oh, look at the little Black girl over there." And so, even from that time period, just definitely recognizing that I'm a Black person in America even before then, but definitely having those examples where people point it out, make you to be kind of that other. And when I just recently having kind of new conversations with my mom or conversations with her about growing up in Champaign and what that was like, I remember her saying something about when I was cast in a play in second grade, and I was cast as the maid. And me, I didn't really understand the history behind that, but her expressing, being very upset and frustrated that I was cast as a maid. And so things like that have happened to me from an early on.
One of the things that's happening, as we both know, is that people are revisiting some of their personal stories of racism, any of those overt, covert experiences, as well as people within the community, our white allies. They're looking at how are they contributing to this, and what can they do to kind of change this in our society, especially here in Iowa City. And so I thank you for sharing your story, because I think it is those type stories that people can hear and kind of envision how they cannot make those same mistakes, moving forward. And I think the conversations have to be had, and that's where we are, where we have to have those. I call them uncomfortable conversations,
Yeah.
because they are, but they're necessary. Now I know that your family, you come from academia, and you have kind of a lot of women in your family that have been an influence within your life. Can you tell us a little bit about your family history and academia?
Yeah, so my mother is the youngest of 5 children, and she grew up in Alabama during kind of the Jim Crow South time. And she has 2 older sisters and 2 older brothers. And of the 5 of them, all of the females, all the girls were the ones to go to college. So they all went to college, got a bachelor's degree, and went on to get master's degree, and even what my mom says, master's plus 60, which is often something that teachers often get. So right before you get your PhD, but enough credits to right before that. So my mother, so from an early, and all of them became teachers, grade school teachers, and had very successful long careers in that. My family definitely instilled in me the value of education, and to see all my aunts and my mother who had graduated from college. So it wasn't a question that, of course I was going to college. And so within my family, my cousins, there's a lot of female. There's only 2 on my mother's side. There's only 2 male cousins, and the rest of us are female cousins. And so of us, we, there's myself who's a doctor. There's my cousin who's a lawyer. There are mothers among us. There are teacher. There's physical therapists, business owners. So we just all have taken, which I really think, taken the example of my mom and my aunts and seen that we can succeed, that we can continue to do things to push that envelope, not only as Black people in America, but Black women in America. So I'm thankful to my mom and to my aunts for paving the way and pushing through and persisting, even though I can only imagine how difficult that might have been during that time. But to pave the way and to be examples for me and my cousins.
I am so happy to see you just smiling, talking about your family, because I am smiling listening to you, and I know that your mom and your aunts are super proud of like the legacy that you all are doing as far as like showing that you can be successful and you have to work hard for those opportunities, but you all are finding ways to achieve that. So thank you for being Dr. Nicole Del Castillo, because that's an inspiration for me and for Black children to be able to see someone that is successful through academia. And so thank you for that opportunity of showing that we can be like Mike, right? in a way.
Yep.
Yes. Everybody want to be like Mike, right? So we can be like Dr. Nicole. So you are the Director of Diversity, Equity, and Inclusion at the Carver School of Medicine. Tell us a little bit about that and what brought you to Iowa City. Most people that when I was growing up, or even now, I say I live in Iowa City, and people are like, where's that? In Iowa. Yeah, and the
Yeah.
next question that comes, Black people live there?
Exactly. Yeah.
Yes.
So I actually, this is not my first time living in Iowa City. This is my second time living in Iowa City. So I did most of my education in Illinois. I went to the University of Illinois for undergraduate, and then for medical school, I went to Southern Illinois University. And so after medical school, you're applying to, or during medical school, you're applying for residency programs. And at the time, I was interested in eating disorders, which is, so I was interested in eating disorders, had decided I was going to do psychiatry. And there were only a few programs in the country who really had a strong eating disorder program. And especially even in the Midwest. So, and Iowa was one of those programs. So when I was looking at programs, Iowa City was top on my list. And I applied, got an interview, which is kind of the next step. And I put, Iowa's actually my first choice when you put your rank list. And my husband and I, we both couples matched, and he was going into anesthesia, and we put Iowa's our first on our list. And By the grace of God, thankfully, we both matched here at Iowa. So I was here from 2009 to 2014 doing my general psychiatry residency and my child psych fellowship here. And so then after we finished, my husband, we moved away because he wanted to do a fellowship in anesthesia. And I did a research fellowship, did an MPH. So we moved away for a little bit. But Iowa City was always in the back of my mind. It reminded me in a lot of ways, being a college town, of where I grew up. During this time when we were away, we had our daughter and then our son. And so I had always envisioned raising my children in a similar environment to where I was raised, which is similar, another college town. So I was like, if an opportunity lended itself to come back to Iowa City, I would not be opposed. And so when I heard about this position as the Director of Diversity, Equity, and Inclusion at Carver College of Medicine, I jumped on that opportunity. And to have, not only because I was happy to come back to Iowa City and University of Iowa, but also to have the opportunity to give back. So within our office, we work with a lot of students, undergraduate students who are trying to get into medical school, medical students who are right in the early trenches of their medical career, and then residents, and then faculty. So within our office, we try and provide support to all those individuals, including staff as well. So I was really excited, not only for the opportunity to come back to Iowa City, but also to give back and to provide some of my experiences as a medical student, as a Black, medical student, what my experiences were like, the way I got there. So to give back in some ways. So that was really a nice opportunity in the position that I'm in, that I have those close connections to mentor, to help support students who on their journey to becoming physicians, and just health sciences careers as well. So.
Yes, well, I'm happy that you're in that role because again, I know that you have personal stories that you can really help people along, and listening, I think, is key, and being able to connect and identify right away with people. That's one of the abilities, especially with your profession as a psychiatrist. That's kind of what you do. So your office released a statement. It really highlighted the deaths of Ahmaud Arbery, Breonna Taylor, Nina Pop, as well as George Floyd. Can you explain kind of what that message was?
So the statement was entitled "Hate Crimes and Violence Against Black Americans is a Public Health Issue." What the statement shared is a lot of times the chronic stress and exposure to racism and hate and violence that are experienced sometimes directly and indirectly can have a toll on somebody's, not only their mental health, but there's also data that's really looked at their physical health. And so that's some of the things that statement highlighted. And because of this, it's a public health issue to highlight this issue, and something that we as a community, as a society, need to look towards and try and to address.
Seeing this as a public health issue really does make a lot of sense, because it's a crisis, and it's something that we really have to look at very closely in order to get past it. Now, White Coats for Black Lives, how did that come about?
So White Coats for Black Lives. So a few years ago, after a previous killing that occurred against a Black individual here in America, White Coats for Black Lives was formed. And since then, recently with the recent deaths with Ahmaud Arbery, George Floyd, Breonna Taylor, Nina Pop, because of that, um, there was a national push to have another demonstration, a kneel-in demonstration. And so when we heard about that, the dean in our office, Dr. Denise Martinez, says we really need to do, we really would like to participate in this. So she behind the scenes was organizing, making sure that all the logistics were put into place so that we were able to hold this event. We reached out to the residents, to medical students who made signs. We reached out to the UI healthcare community to let them know that we would be holding this event. And so we didn't really know exactly how many people we would be expecting, but we had a really great turnout. We had the demonstration. How we organized it is we had a brief introduction. I spoke, and one of our residents, a surgery resident, also shared. He shared for a brief moment, and then we kneeled for the amount of time that the police officer was on George Floyd's neck. That was kind of the organization of the demonstration that we held at that time.
Yeah, I know that people have really wanted to show and be a part of some type of demonstration, and I thought that that was a great way for the white coats to come and show their support for Black Lives Matter. One of the things you've mentioned is because of the frequency of what we're seeing, we're talking about George Floyd now, but there's others that we just named and many more beyond that that have had their lives taken because of racist acts, point blank. And at some point, when you're, hearing this all the time, and you feel a little less empowered, you kind of get desensitized to these hate crimes. I know that you've mentioned that a little bit. Can you talk a little bit about that?
Yeah. So during, I think that my first realization, or my first kind of thought about this, was after the demonstration. Um, we were interviewed, or I was interviewed by the local news, and the newscaster asked me, are you happy with the turnout? Isn't this great? And my first reaction was, I was surprised that we had so many people come out, and that was, a really great thing. But I wasn't necessarily, feeling happy. And I realized that my emotions, I had almost become desensitized to, any emotion. I had become somewhat tired from all the things that had been going on over the years, racism, just chronically experiencing it myself, and just seeing it happen, so it directly and indirectly happening, and just had grown tired, and in some ways had lost some hope that things were actually going to change. I know that there's, a Will Smith quote that people have been sharing, that, racism is not necessarily something that's getting worse, it's just getting filmed. And so, so there's some of that sense, I feel like, definitely from people, in some ways from my generation and the older generation, just, are just used to this happening, or, somewhat, in some ways seeming to be, seeing this and just are exhausted and tired from this happening. But in some ways, I also wonder about just kind of losing some of that, the emotion behind it, because we just become desensitized to it.
Yeah, at least for me, I think sometimes when it happens over and over and over, and you feel somewhat powerless, like it seems so huge. How do you change it? And I think one of the biggest things that we've not done to change it is have the conversations. One of my nieces was here at school, and there was this really obvious racist thing that happened from a white child there. And so I was riding in the car with her, and she was talking about it. And then she said, "You know what the issue is? Everybody knows it exists, and no one wants to talk about it." This is a 16-year-old in high school that is saying that it's an issue, but no one wants to talk about it. And I think that has been probably the number one issue, is that it's such an uncomfortable conversation, even for me as a Black man, but we have to talk about it. We need to hear the experiences, and we need to figure out ways to get beyond that, assess ourselves, and then we can move forward. So, yeah, I'm so happy that you've been very open and sharing your story today. Now, you are the Director of Diversity, Inclusion, and Equity. I probably mixed that up a little bit.
It's okay.
It's a long one. So what are some of the things that you are hoping to see in the future, are doing now? It is large. This is racism is a or systemic racism is a large thing to even conquer. So what are some of the things that you're anticipating?
Yeah. So I think with with what with the statement that we came out with about how in some ways just racism as a public health issue. And so looking at, I think a lot of the conversations have been around, police as a system, the criminal justice system, but really looking at the healthcare system and what are some ways that we can break down some of the systemic racism within our system. And so I have been really fortunate to be involved in the changes that are occurring within UI healthcare. With what you've been talking about, where some people just don't want to have these conversations, they don't want to. Because it's uncomfortable, it makes you feel uneasy. It's not something that is easy to hear or easy to face. And so that is fortunately some of the things that we're trying to do, because often without hearing these things, without having these conversations, without hearing experiences, it's hard to move to change.
Mm-hmm.
So within UI healthcare, we've been um, really trying to listen to people's experiences, Black individuals within our UI healthcare, trying to hear what their experiences has been. So we've been having listening sessions. We started off with the medical students. We've had one with residents, with faculty, and with our staff. And so our hope is, and already, I'll be honest, with these listening sessions that we've held, we've had leadership within UI healthcare present to hear the experiences, the suggestions that individuals within the Black community have for leadership. And already we've started to make changes on the medical student level, on the resident level, on all these different levels. We're starting to make concrete and also really be thoughtful about what we can do to make a change within our system. So we are planning to formulate a task force of individuals to kind of come up with concrete task that the leadership can do going forward to mitigate some of these injustices or things that people are experiencing. And some of the examples of things that people have shared are feelings of isolations, feeling like there's not enough representation within their community, experiences with microaggressions, experiences with, again, overt and but also a lot of the covert racism, not anything directly at them. So those are some of the things that we've heard. And so through that, we're hoping to have more trainings on implicit bias and how that some of these things that you might not even realize that you're harboring, some of these thoughts, some of these feelings, how to recognize them, so then you can try to not let these ingrained thoughts affect your actions and the things that you might do.
Well, I know that it's not an easy task, and many are calling upon you right now in the community. So, thank you for your leadership. Thank you for being outspoken about your personal experiences. I think that's always a hard place to put yourself in, because none of us want to be judged, right? but at this point, I think the personal stories are essential in order for people to really connect how people are feeling during this time. Thank you so much. Is there anything that you want to tell us before we end today?
No, I think just maybe just leaving with this quote from James Baldwin, not everything that is faced can be changed, but nothing can be changed until it is faced.
Yes, I love that. And we will end on that note. Thank you
All
so
right.
much.
Thank you.
That's our episode for today. If you would like to follow along with the city's progress on the Black Lives Matter movement, you can visit icgov.org/BLM. We'll be back again next week with another episode of Community Connection. Until then, remember that we're all in this together and Black Lives Matter.